Washington Journal continues.
Stephen Morrison is director of the Global Health Policy Center at the Center for Strategic and International Studies, joining us this morning to talk about global COVID-19 vaccination efforts. Good morning, Stephen Morrison.
Good morning. Thank you.
Update us on where the global vaccination program, what's called the COVAX program, is. How successful has it been thus far?
Well, COVAX is a solidarity mechanism. It was established in April 2020, early in this pandemic, as a mechanism to attempt to bring vaccines in a timely and affordable way to 92 low and middle income countries. It's had a very rocky year. One of the major problems it's confronted is the disruption in supply from India. It made a big bet on AstraZeneca's vaccine produced by the Serum Institute of India, which is one of the major producers worldwide. And when the pandemic struck, the Delta pandemic struck fiercely in India in the spring, India imposed, like many countries, on nationalist grounds, imposed an export ban. That ban has only been relaxed very recently. That was hugely disruptive to COVAX. There were other problems that COVAX experienced. It was not terribly good at creating reliable and accountable contract relationships with many of the manufacturers. It wound up being subject to great delays in deliveries and uncertainty, forced to live in uncertainty. Oftentimes, the vaccines delivered were very near their expiration date. Now, recently, as they're approaching the end of the year, it looks like they're accelerating delivery. By the end of this year, they will have delivered about 800 to 900 million doses. Their original target was 2.3 billion doses, so they're falling quite short on that front. The United States government
and on that, let me ask you on that, how has the demand now from the rise of the Omicron variant put pressure on that COVAX program?
It's still, I mean, let's get to Omicron in a moment. I mean, Omicron is creating greater pressure and anxiety to accelerate vaccinations.
Yeah.
You know, in low income countries, we're still looking at vaccination levels at under 8%, as against in high income countries, the United States, Europe, Japan, and elsewhere, above 60, oftentimes above 70%. Fully vaccinated in the population. One last point on COVAX, 2 points I want to make for our listeners. The United States has made a commitment to deliver over 1 billion doses of the Pfizer mRNA vaccine over the next many months to COVAX through next September. And those deliveries have begun. We're running at about 50 million per month. The European Union has committed about 500 million doses, and those are beginning to flow. Overall, within the world, production is rising dramatically right now. By the end of this year, which is fast approaching, Western vaccines will have risen to about 7.5 billion total production. If you add in the Chinese and Russians and others, we're looking at 11 or 12 billion, and that number is expected to double in 2022. So we're entering a different phase in which I believe COVAX will be able to function better, and supply constraints will begin to ease.